Okay, first of all, thanks for talking to us. You are 4 months after having had a endoscopic brow lift, upper lid blepharoplasty, lower lid blepharoplasty, which honestly put together is essentially an upper facelift.
Yes.
Hidden Scar Upper Facelift. Tell me about the last 4 months. Tell me about it as if I am someone who is thinking about having the surgery. What are your thoughts?
I actually just had this discussion with a friend of mine who scheduled eyelid surgery after seeing my results.
Oh,
I am wishing that I had done it before.
Mm-hmm.
Putting on makeup takes 5 minutes. I'm not trying to camouflage anything anymore.
Mm-hmm.
And I don't, have to visibly cringe when I look in the mirror first thing and feel like
cringing.
I don't look like my mom right now.
Mm-hmm. All right, how about this? Let's do a timeline because patients really want to know about the recovery. What was first week like?
First week wasn't too bad. I mean, my biggest thing was I'm kind of a screenager, so not being able to be on my phone or watch TV and stuff. I listen to a lot of podcasts.
So a little bit of blurry vision.
A little bit of blurry vision.
Very common comment.
Yes.
When did that go away?
It took a couple weeks.
Okay.
And then I just increased the font on my phone so the person in the back of the grocery store line could read what I was typing.
Hopefully it wasn't anything bad.
No.
Okay. All right. So how about this? When did you first feel comfortable enough to drive?
Oh, it was less than a month for sure.
All right.
Yeah.
Do you think it was closer to 2 weeks than to a month, or was it longer?
Probably between 2 and 3 weeks.
Okay.
And I think that might have just been because I was enjoying, couch riding for a few weeks.
Well, how about that? When do you think you could have gone back to driving?
Easily at 2 weeks.
Okay. All right. Now, how about this? What about work? What was your whole return to work scenario like?
I was between jobs, so I took an entire month off.
Strategic.
Yes,
okay.
yes, but I could have been back at work in 2 weeks.
Okay. All right. Okay, that's helpful. And then when do you feel like the bruising and swelling went away enough that you'd go out in public and not feel as if people might be noticing something about you?
Within 3 or 4 weeks, probably,
Okay.
I was able to hide any bruising
right.
with makeup. It wasn't perfect. There was still swelling that I noticed, but nobody else did.
Right. When would you feel comfortable going to the wedding of one of your best friend's daughters, just as an example? Just hypothetically.
Probably 4 or 6 weeks,
Okay.
just to be perfect.
All right. Okay. Is there anything that surprised you in a good way?
The healing process, honestly, was
Give me a little bit more detail.
my frame of reference is from my mommy makeover from 2 years ago,
okay.
and that was a lot, an entire torso overhaul.
I gotcha.
So I was anticipating having a much more difficult recovery. But aside from the fact that I'm a side, curl up in the fetal position sleeper, that was the most annoying thing about.
Kind of having to lay back.
Yeah, having to just, kind of be upright facing that way instead of curled up like a little bean.
We didn't talk about pain. Why was that? Was there no pain, or you just don't remember it, or?
It was a little bit of pain afterwards, but it wasn't bad at all.
Okay, so not the biggest thing to think about after surgery.
No, not at all.
Okay. All right, so we talked about what surprised you in a positive way. We always want to paint an accurate picture. Was there anything that surprised you in a negative way?
Not really. Okay. I mean, I think there's an image you have in your head about what is going to look, what everything's going to look like. And, coming to terms with the fact that I'm never going to look 35 again. But that's a me thing, not a surgery thing.
So definitely surgery was the right thing to do.
Absolutely.
Yeah. How about this? How many years younger do you feel it made you look?
I would say 5 or 6 at least.
Okay, not bad. Not bad for only half the face.
Yeah.
All right. Okay, I love it. Thank you so much. These questions, these answers are things that patients are really going to benefit from. Thanks again.
You're welcome.
All right.